Hi, my name is Alex Hall and I'm a lecturer in the School of Health Sciences at the University of Manchester. We recently published a paper entitled Adapting the Germ Defence Web-Based Intervention to Improve Infection Prevention and Control in Care Homes, Interview Study among Care Home Staff in JMIR Formative Research. In our study, we wanted to explore the potential of using a web-based tool called Germ Defence to improve infection prevention and control, or IPC, in care homes. IPC is really important in care homes, but is complex and difficult to achieve. Care homes are particularly vulnerable to infections because of close contact between people and the fact that many residents have complex health needs. Effective IPC can reduce the spread of diseases and prevent hospital admissions, but care homes face many difficulties in ensuring effective IPC, for example, from poor or variable access to personal protective equipment, inconsistent guidance, and issues with staff training and adherence to IPC protocols. There are also tensions in using clinical IPC measures while trying to maintain a homely environment for residents. The COVID-19 pandemic made these challenges much more visible, but there are many other infections that affect care homes, such as seasonal flu and norovirus. Germ Defence is a behaviour change intervention designed to improve IPC behaviours, such as hand washing. It provides targeted, tailored advice about how and why people should use IPC behaviours. It encourages people to think about their current behaviour, such as frequency of hand washing, and think about how to increase it. It was originally developed for use by the general public to address flu outbreaks, and there's a large clinical trial showing it was effective in increasing hand washing and reducing respiratory infections. Germ Defence was later adapted for use during the COVID pandemic. We wanted to see if Germ Defence could be adapted to meet the needs of care homes to improve IPC practice in these settings. First of all, we consulted with a small number of senior care home staff about IPC challenges, showed them the Germ Defence website, and made some initial changes to ensure that it referred to care homes. In the research study, we worked with 21 care home staff from 4 care homes. We used a method of individual think aloud interviews in which we showed each staff member the Germ Defence website and asked them what they thought about it as they worked through it page by page in real time. We spoke with 10 staff to begin with, made some changes based on their feedback, and then showed the revised version to the other 11 participants. There were mixed views on how useful Germ Defence might be. Most participants felt that the overall concept was clearly relevant to their context. Some felt it might be useful as an introduction for new staff or as a refresher for current staff, but others felt that they were already doing what Germ Defence suggested and that it didn't seem to add anything to their existing training. There were also mixed opinions about the level of detail provided in the information offered by the site. Some participants felt that at some points there needed to be lots of information, but at other points it was better to be brief. Participants had lots of comments about the overall appeal of the website. They made lots of suggestions for revising the images and the text. Some felt that in its current form it was too text heavy, and many felt that they wouldn't have time to sit and read through a text-based website. Some suggested that more interactive or engaging content, like audio and video delivery, would be preferable, and some said that they preferred practical training. Some participants were not entirely convinced by the goal-setting activity in terms of making a plan to increase behaviours like hand washing, because they said that externally driven requirements would ultimately have influence over individual behaviour in these settings. It's important to remember that Germ Defence was aimed at a very different population, the general public, and so it wasn't clear how suitable the particular behaviour change mechanism would be in the context of care homes. So overall, much more work would need to be done to make Germ Defence more engaging, accessible and relevant to the care home workforce. We chose to submit our research to JMIR Formative Research because of its focus on the feasibility of digital interventions.